today, whatever companies are doing with respect to rural market is much more than what any company was doing, let's say 10 years ago. So in that sense, certainly more people are there, and while you look a couple of names, but more than 10, 12 companies are far more aggressive in the rural market today than what they were in the past.
Okay, let me take this opportunity to thank hopefully this will remain your life again. And having given him this, we're not letting him go. Next is a short panel discussion, so I invite you to go take place. Dr. Rajan, would you like to come in and receive your you with this memento so that you don't go away. All right? And Venkat, would you also join? We're now going to spend about 15 to 20 minutes on a moderator group discussion. I know many of you didn't get a chance to ask Rajan questions. So this is a time for you to ask questions to all the three presenters in the afternoon. And I'll be the moderator and trying to make sure that the questions are streamlined and be efficient. I also wanted to make an announcement before you leave. There is an evaluation or feedback form. It's in blue. Please do fill it out whenever you get a chance. We appreciate you taking the time to do that. If you're going to be here tomorrow, you can do it afterwards too. But if you're not, some of you not returning tomorrow, please do that and give us the feedback at least for the day. Let's start the moderator discussion. We now invite you to ask any questions to any of the panelists.
My question is to Mr. Venkat Changoli. The healthcare sector in totality, from you described the 108 emergency ambulance system that you have. How can that be integrated with the the hospital network, for example, and the health insurance? I mean, I'm not from this industry. I'm just how can you integrate your delivery systems and the hospital network and the healthcare insurance service providers to give a holistic solution in the rural market?
And this is basically a successful model in one part of the healthcare. The entire thing, the prevention, curative, the emergency, the hospital phase, if you take up in all of them, this experiment taught us some lessons which can be extrapolated. One is leadership is important in healthcare. It is not necessary that doctors only can bring better care to the health sector. Professional managers and leaders are required in health sector more and more. It may be an exception that Pratap Reddy is succeeding, but we require many more professional managers getting into healthcare sector to provide that professional management, be it in marketing, be it in leadership, be it in various areas. Number two, quite a lot of technology required in healthcare, not necessarily again medical technologies. Be it the telecom to transfer those images from rural areas to here, be it that IT to various integrating those applications to whether it is for analysis or whether it is responding, or any other technology, as I said, material technology, field technology kind of thing can be extrapolated to hospital sector. The third one is very clearly innovation. In a small spectrum of emergency itself, we could do so many new things which were not in this country. Either it is the pre-hospital or the hospital care. Lots of innovations can be done. For example, in Goa, we set in a hospital called community hospital, a government hospital, which how it looks like. In that 250 square feet we took, modified the entire thing at 10 lakhs and equipped them with medical equipments so that there is a continuity of medical care takes place there. In the entire 5,000, 10,000 square feet, just 250 square feet of emergency room, we upgraded that with latest technology, medical equipments, and trained manpower. Just to tell the government hospital that if only 3,200 community hospitals in the country, if they are upgraded like this, the patients, 80% of them who go to the government hospitals get stabilized, get good treatment there. And finally, I think the research and training in the healthcare, hell of a lot has to be done in terms of whatever we do, 6 lakhs doctors will not become 20 lakhs doctors. You need paramedics, you need qualified science graduates trained as paramedics in the villages who can treat under the guidance of an advice of a doctor virtually, may not be physically, then only 1 billion can get. So these are some of my ideas for the healthcare.
I'm going to ask a question to all the three panelists so that we get a synthesis across them. And I think one of the common ideas across all three of them, Rajan, you talked about innovation, you talked about rural marketing, you talked about emergency services, is the idea that we need more innovation, particularly in rural market, in healthcare services. Now, what do you think is the role of mobile technology and mobile devices in enabling that or even accelerating the progress? For example, in your emergency services, Venkat, one of the things that we have not talked about is the pre-emergency services. What are some of the things that you can do using the mobile phone, the moment call is made, to maybe equip the people who are very close to do some immediate actions, okay, that could be life-saving? We know that lots of accidents, the response time is very critical. So by the time you take 25 minutes to get to this, something could be done. And how could you use, Shiva, these mobile technologies to actually accelerate not only the emergency services, but also basic services? And one of the things that I wanted to ask you about is the water, which is really a big issue in a lot of rural markets. How can we improve sanitation, save lives, people from diarrhea and so on? Rajan, you talked about innovations. That are we doing innovations because we are having a lot of problems in the system? What if we go to the root of the system and eliminate those problems? So maybe all of you can comment to various degrees, and perhaps we can start with Shiva.
At a systemic level, I talked about 3 things that technology can be done, and all 3 will be equally relevant using mobile devices also. One of them is the remote services, whether you use voice to interact, whether you use other guided interaction that is possible. And remote services need not necessarily be just using mobile phone as a device, but today we are looking at in the financial inclusion projects. For example, the rural micro ATMs, which through biosensors and some of the other equipment you can actually transact for financial service banks, and as long as you're able to do real-time kind of transactions, that is saving very significant kind of a cost and time. Health example, I already talked about what one could do using remote services. Personalization of solutions is something which I talked about, and finally how do you integrate them into operations is another area that you can use in use of the mobiles. One of the interesting things that is happening in whether it is disaster or epidemic management, is also true in agriculture, is how you actually gather data from the communities and users and use internet to visually map it and let's say watch the flow of epidemics from one part to another part, how it is moving, and therefore how do I advance on that? Because significant amount of loss in agriculture is when there are epidemics in terms of pest attack or some other kind of thing. How do you take an advanced care? If you miss by an hour some treatment, you are not just one farmer but thousands of farmers in the vicinity. And that we can certainly predict with individual farmers actually feeding some data into mobile phones. You are visually mapping that. You are gathering some data from the weather forecast, combining all of this and putting it back in an actionable form where whoever that need to take action. So when I think of actions with mobile devices, besides the independent individual action that I talked about earlier, some of these integrated applications I think will be extremely handy in making a significant difference.
Yeah. First we started, I don't think at least my project would have been successful if it had started 10 years back. But for this required this project would have been successful. How we made use to now? The entire caller, when he calls and whatever data is in the screen in the center in Hyderabad or in Ahmedabad, that data gets transferred to the mobile phone of the paramedic who is there in the ambulance, which is 400 kilometers away. So there is no loss of information for him. He knows exactly patient condition, his vitals, his all that is there transferred. Same way, we also enabled sometimes the ECG transfer through mobile. So from Rajkot, he sends it to Ahmedabad. So from Sivakumar, he sends it to Hyderabad. Same way, suppose in rural areas, sometimes there is no connectivity. There is no, we have something called automatic vehicle location and track equipment, which we installed in ambulances in some states, where we can look like in Goa, all the 18 ambulances, where they are today, I can sit in Ahmedabad and see exactly which patient they are carrying, what are his vitals and where is he stopping, who is inside, all that kind of information can be tracked sitting at Hyderabad. About all the state, the 3,000 ambulances I can track. They hardly cost anything really. Cost of transportation, cost of capital is really nothing. But the smallest use we made many times of mobile phone is, he drops a patient, but I don't know whether before we launched this AVLTs in states, he just presses the R button there, saying it's released, vehicle is released. So otherwise earlier I was depending on, he has to ring up and find out, tell that way. Today he just sends that, it gets upgraded in the system. So that the dispatcher knows exactly that his vehicle is busy. And particularly more and more mobile health in terms of transfer of medical, the patient data to not only center, later we will also transfer to the hospitals, which is not happening today. Today the problem is, if I tell in advance, I am bringing this patient to NIMS, NIMS will go away. The doctors say, oh, you are coming, is it? And they go away. Many government hospitals, if I inform in advance, it's actually counterproductive. But once we come to a stage where they are a little more equipped, attitudinally, equipment-wise and skill-wise, this is going to be a great tool in terms of saving time, preparing the hospital, all that will happen. Which I must say is really at a very good. So you have technology, but there is no attitude and equipment in the hospitals. And even in private hospitals, because they want to know, private hospitals want to know the income profile of the patient, not the medical profile of the patient. Can you afford to pay a couple of lakhs or not, they want to know. Whereas the government hospitals, they are not interested in knowing. Once these two, we work on that, then only the technology can be used.
Couple, I have no original ideas. All I can do is bring to your attention some things I've read in literature to shed insights. I have a colleague of mine, Glenn Berry, who's done a lot of work in the area of services, including healthcare. And he distinguishes between want services and need services. Healthcare by its very nature is a needs service. In other words, you fall sick, you need that service. Whereas if you're going to a massage parlor or if you're going to a game, that's a want service. You want to go play and watch a game, movie kind of thing. That's one. If you do a situation analysis, what you're really looking at is a rural market as a population dispersed over 600,000 villages. So obviously, every technology that can be leveraged for efficiently serving this dispersed population needs to be leveraged. There is a nice case by Cash Brunner on Arvind Eye Care Hospital's Harvard Business School case, and some follow-up write-ups about this one, where this is brought about very efficiently when they have camps and villages for screening for every 10 patients they screen, they identify about 1, 2, or 3 who need to come to Madurai for cataract. The rest of them, the decision is made by, telling all of this information when an patient is screened in a village through a satellite uplink and a downlink is sent to the central headquarters in Madurai, and there they look at the information and make some diagnostic decisions. This individual needs to come to Madurai, or this individual, all this needs, person needs is an eyeglass, and they are in a position to provide that prescription and do that. So it is a cost-efficient solution. And one other thing in relation to all that, here we are talking about wireless or an electronic connectivity. There is a group of economists did a piece of research about the role of road connectivity to villages and how it impacts this one. When villages are connected to cities, nearby cities, with roads, they find that the infant mortality in villages comes down. The average lifespan of villagers goes up. The prosperity of the villages goes up. And the cause and effect is very difficult to predict. Activity, is it willing to go and set up a clinic in a village? Or is it a villager able to come much faster to a nearby satellite city where better healthcare services are available and so on? So in as much as all of this mobile technology plays an important role in providing healthcare services to rural markets, the importance of the road networks as well should not be overlooked.
I've got a question.
Yes, Mike.
Thank you. My question results from the presentation that Professor Rajan made, and that was about it is because at times it's a lack of state's action, and the state has failed. That's why there are opportunities which has existed. So my question is to both the speakers and also to Professor Rajan as to what role do you see for the political actors and about the management of political system for the kind of services you are providing, because both agriculture as well as health are politically as well as policy-wise very sensitive. And what Shankar also said, Sivakumar also said about the rollback of agricultural reforms and also kind of interference you can see from the political system. So how do you manage that, or what role do you see for that? It could be for Venkat as well.
Yeah, I think wherever we are dealing with services which can be basic services or which reach a very large number of people, especially people with low incomes, certainly I think the government role is quite critical because we are operating in the same domain, so to say. And India government is both a regulator as well as a player. So consequently it gives rise to its own conflicts. And when each of our projects started from the time idea was conceived in 1999, at least until 2004, the first 4 to 5 years, literally 1/3 of my personal time went into engagement with the government because agriculture is a state subject. And every single state had to modify their agricultural product marketing act because by design each of us transacted outside the market yards, and that was illegal. And unless the law changed, the business model itself could not be rolled out. So you engage the political system and communicate and share with them as to why this model, actually in our case, why this model actually serves the spirit of the act that was done some 50 years ago, much better in terms of benefit to the farmers than that act in today's context. That act may be relevant when it was done, was certainly relevant even 10 years ago. And today it is not so, and therefore how it will. So one is in terms of, from the very spirit of the current regulation, what needs to get changed, and therefore government has a role in terms of reforming. The second is that obviously in a democracy what happens is that various leaders who get elected and come in have their own vested interests based in their own current business interests. In agriculture, when the market was getting transparent, when everybody knew prices sitting at their homes, after the e-Chopal initially and now mobile phones bringing information to their homes, meant that the traditional players could not extract as much profit as they could. And so obviously some of these people are part and parcel of a political system as well. And therefore there is a certain vested interest that need to be countered. And the resistance from some of these people actually, fortunately in our case, happened much later in the day. If the resistance was very aggressive in the very beginning, I don't know, hypothetically speaking, maybe we would have seen the light of the day, maybe we could not have. But initially they ignored, saying that what can corporate sector do in agriculture, computers in villages, they never work, all of those kind of things. But as the share of e-Chopals went up and transparency really expanded a lot more and their bargaining power was reducing, mandis in Madhya Pradesh were shut for 15 days saying that our agriculture reform should be reversed. But by then the farmers had tasted the benefit of a more transparent system. And at the end of those 2 weeks, the farmers spontaneously, in very, very large numbers, some 35,000 farmers came onto the streets of Bhopal to apply pressure on the government, saying that if at all you do something, it should be to allow more companies to do these kind of innovation rather than shutting whatever has happened also already. So I think that is one way in which the political system can be countered, because in democracy, at the end of the day, they all depend on people who are getting back elected. And there are conflicts of interest where, say, you are also a player and you are also a regulator. And government ought to procure food grains for their own public distribution system and saw that the farmers were coming. They said, we will not give you license to buy, so that we compete our buying and then only we give it. So there are all kinds of roles that the government plays. I think a constant dialogue is something which will help. And understanding that government actually operates at 3 different levels, starting with the political setup, then there is a senior bureaucracy, and then there is an operation level officers. Each one have different levels of motivation, constituency in which they are working, and therefore how to align with each one of them is very critical in influencing and shaping policy as it should be. But the role of government and the role of politics is very central when you are engaging businesses with low income people, our basic services.
I represent the agri-import industry.
To this politician, see, in the 11 states where I am operating, I am proud to say, not 1 rupee I was to bribe. The same politicians whom we talk. I am in Congress states, I am in BJP states, I am in DMK state. Now clearly they also realized that notes and votes earlier, now development also gets some votes. And development, they cannot do, they also realized. Better we involve some corporates, professionals with high integrity. It's very clear, credit they have to take. In a meeting like this, naturally CM cannot sit here, he has to sit here. A collector has to sit here. The minister has to sit here. Whether they contributed anything or not, they have to sit here, first garment to them. You have to say, without them I won't exist. All this you will learn these tricks. But that is small compared to, because if you want to do something for low income poor people, you cannot think of credit, you can't think of you building your brand. Your brand gets built with your good work. But they want their brand to build political brand which leads to votes, all that is natural. In a meeting here, Modi will tell me, I will talk about 108 ka kahani, thoda humko chhod do. He will tell. Rashid Reddy used to say, I will tell the story of 108. So absolutely, that is bare minimum if you want to really do something of a large level. You should not compete on that. You are not gone there to compete with the politicians. You are gone there to complement with your professionalism and with your integrity. One thing clearly, you can still, many times your integrity and your value systems are exactly opposite. But They will allow you to do the work for the benefit of that man because their interests are also there. And your integrity, as I told you, I did go to a state where the chief minister said, when I want money, you did not go there. But there are many who want to do it matching your values and your integrity. At the same time, there is in MP, I remember, when I wanted to buy ambulances, health minister said, no, I want to buy. I allowed him. Now he said 13 lakhs is the lowest quotation. When I am buying at 10 lakhs, he said 13 lakhs is the ambulance. I went to chief minister and told you health minister wants to spend 3 lakhs extra. Up to you, whatever you want to do. But at least I had guts to go and tell the CM. He cancelled that, he sacked the health minister, all that happened. So nothing happens to you if you want to do something good to people. But if you are bothered about your seat, you will not be able to do. Here one of the ministers told me that I will get Venkat sacked down. Now that guy's portfolio got changed, nothing happened to me. As long as you do your work with integrity, with focus on the cause that poor people will get impacted, let me not dilute, absolutely you have much more to be done. It's like this hall, you have to expand much more behind also, with the same politicians.
If I can make a quick remark in reference to that question. Both of these individuals have very closely worked with the government. I have the luxury of being critical as an academic. It's more like thinking loud about some of these issues. And one other thing I used to always think about as a reference to healthcare services is prevention of certain epidemics from happening. Like December is the year when you celebrate, you have this World AIDS Prevention Day. And often I used to think in terms of the hundreds of trucks backed up between at the state borders for days, and that is an AIDS breeding ground. What all interstate traffic, there is absolutely no restriction. Trucks could just breeze through, and whatever toll they need to pay with an electronic tag, they can pay. The savings, the elimination of the spread of the AIDS epidemic, the benefits that the society would accrue would be much greater than the money that the government spends on providing treatment to people with AIDS. It's an abstract thinking whether it will ever happen in the real world.
Okay, we're
10 minutes over time, and a lot of you are looking at your watches. So we don't want to keep you any longer, but however, we invite you to ask your questions after this to the speakers that will be remaining. And again, we wanted to highlight that the reception starts at 6 o'clock. It'll go up to 7 o'clock, and 7 o'clock we'll start the dinner. So we look forward to seeing you at the reception at the Recreational Center grounds, which is not very far from here. So we'll look forward to seeing you starting 6 o'clock. Thank you. Thank you, everybody.
That's